Hello everyone, I'm Dr. Blair and I'd like to tell you about drug interactions and cannabidiol. I'm hoping that I can give you the guidance that will help you in how you use cannabidiol. Having spent 40 years in medicine, I can tell you I've seen quite a number of drug interactions and drug problems. Certainly is a difficult area. So let's proceed to the agenda so you have a little bit better idea of what we're going to be covering today. The burden of disease, the drug interaction pathways, and cannabidiol metabolism, as well as how CBD interacts with some of these other substances, some of the other drugs that you may be dealing with in your patients. We'll talk about managing those situations, and we'll have a question and answer at the end. If we're looking at the problems related to drug interactions in this country, not concerning cannabidiol, but concerning the whole industry, we're spending about $130 billion per year on it, and there are upwards of 100,000 deaths associated, over 2 million hospitalizations, again, per year, and 79,000 children are hospitalized with complications of a drug interaction. So this is quite an enormous problem, one that is often not recognized, but it is certainly important. And it's especially important if you're using the cannabidiol in this process, because you don't want to create a problem and with an interaction. On the other hand, you want to reach therapeutic effect. Drug interactions are probably the most common question that I get from patients and from providers about cannabidiol. And I'm hoping that I can address most of those issues here today. In the background, we have the endocannabinoid system, where cannabidiol is working at actions on the neurologic, the immunologic, and the endocrine system. Certainly, our patients who have any one of these related problems that may be chronic problems, they're going to be typically on medications, and that's going to be susceptible to an interaction. So you're always going to be dealing with these substances and how they interact, and always these particular questions. If we're looking at drug interactions, we're thinking in terms of drugs, and the endocannabinoid system is one of the most important that you need to understand. The pharmacokinetics of the drug interactions, how that works, how drugs are metabolized, and how CBD works within the body and how it's metabolized. And we're looking at drug metabolism and the processes that are involved. And then we're going to take a focus on interactions, both good and bad, with regard to cannabidiol. When I talk about the pharmacokinetics of a situation, of a drug, there's several different pathways, and there's several different approaches to drug interaction. And the first is absorption. Once the substance is absorbed, whatever that drug is, then it has to circulate in the body. There are circulation issues, whether something is protein bound or it's lipid soluble, where it goes and how it's released. Next step is metabolism, how the body handles it after it has done its work or not done its work, how the body gets rid of that. And then, of course, the elimination, excretion in the urine or the stools, getting rid of that substance and getting it out of the body, sort of like the detoxification. In terms of drug metabolism, the main pathway we're going to be talking about is the cytochrome 450 system, which is the common pathway for so many different types of problems. Now, there's a lot of drugs that are excreted right in the urine, and so that's not much of an issue, and there's no interaction in that characteristic. But our focus will be on looking at the liver and how it handles this particular situation. Looking at the cytochrome, the liver cytochrome 450 system, there are a number of different special pathways that have been defined through these specific enzymes. And you can see a list here of the number of different types of drugs that pass through that particular pathway. Well, certainly there is a potential for interaction. Now, the ones that we're going to be focusing on are the ones where I've got some markings on, the 2C19 and the 3A. Those have potential interactions, and you can see the list of medications that are associated with that. When we're looking at cannabidiol metabolism in the liver, cytochrome 450, we're really focused on just two pathways, the 2C and the 3A. Now, the 2C9, it does show some interaction, but it has not been shown to be significant. In fact, in looking at the neuropharmacology, the clinical relevance of this data is actually quite questionable, because a lot of these studies were on theory and not actual testing in patients. And in addition, high doses were used. And so this is theoretically a very high dose effect. In fact, low doses had no significant interactions with these pathways and these degradations, whereas high doses did have some significant interaction, but it was not complete. And there's only one report that I've found in the literature that identifies one substance that has an increased level that could run into problems. But there are no major events that have occurred because of combining cannabidiol with any other substance. One interesting way that CBD interacts with the body, in fact, the whole endocannabinoid system is interacting with the opioid receptors. And so this interaction is actually occurring between the opioid receptors in the brain and the cannabinoid receptors. And CBD plays a significant role in this pathway in terms of stimulating the endocannabinoid system and modulating the opioid receptors. What we see with cannabidiol in relation to pain and opioid use is that cannabidiol gives the effect of an increased analgesia, an additive effect without any respiratory depression, and it decreases the tolerance of opioids. You know, one of the big problems with opioids is requiring more and more drug in order to get a benefit. This actually reduces that tolerance issue significantly. And what I've seen in my clinical practice has been a reduction of about 75%. Furthermore, we're seeing cannabidiol decrease the addictive symptoms that may be involved. And it decreases addictive behaviors as well. So that craving, that going after doing whatever an addict needs to do or wants to do in order to get that particular substance seems to be decreased dramatically. So you have all these number of effects from that good interaction that CBD is bringing to the situation. If we look at epilepsy, that's probably the condition where we see the most collection of drugs and probably the highest risk of some interaction. But you notice from this, the bottom list of anti-epileptics, or you see that there is actually very little consistency with the effect of CBD and using these drugs that are used for epilepsy. So you can't establish any consistency, and you don't know whether it's going to be higher or lower in any particular case. There's a few outliers that suggest that it's definitely going to be higher or it's definitely going to be lower, but in my clinical practice, I've not seen any consistency in that regard. Furthermore, most patients who are using these medications are looking to get away from these anti-epileptic drugs. And so if reducing the dose or eliminating the dose is definitely a possibility and could prevent and many of the types of interactions that might occur. The other interaction that CBD has is on the endocannabinoid system itself. Probably the main action on the endocannabinoid system is to prevent the breakdown and the disappearance of the endocannabinoids. I've given you a list of currently identified endocannabinoids that we have in our body. Certainly there's quite a collection, and they all have specific action, and they're all doing things within the body. Almost all of these go through the pathway of the fatty acid amide hydrolase. And this is a process whereby these natural substances that occur really mostly within the synapses of the nerve transmissions, these are regulated and the metabolism takes place at those synapses through the FAAH. Now, if you get a decrease in terms of that metabolism and an interference, then you're going to have higher levels of these substances working, or they're working longer. And what we've seen is that by regulating this particular pathway, it appears to embrace and enhance the entire endocannabinoid system to the level of a restoration, where people who may have had an endocannabinoid deficiency have the potential of restoring much of that function. In addition, cannabidiol has some unique aspects for signaling right at the nuclear receptors. And so these are the actions that CBD can have on epigenetic changes. So it's not just this particular event and this particular time. These are genetic changes that are occurring inside the nucleus and changing the cascade of enzymes, as well as some of the signaling that connect with the DNA that is present. And so you're having a shift overall in the body, and that means that you have different metabolism going on and different overall actions and a restoration, a potential restoration for the body and the endocannabinoid system. Now, CBD is involved in 3 of these 4 pathways, in the PPAR alpha as well as the PPAR gamma and the AHR pathway. I point this out just to say that cannabidiol is doing a superlative job working on the nucleus and at a nuclear level, in addition to all of the other effects that CBD has. One of the things that you're probably interested in is in terms of enhancement. What can you do to enhance the effectiveness of CBD? Well, from practical experience, we know that some terpenes and some of those additive substances that we've been using as herbs or food supplements actually have their beneficial properties are as terpenes, and those terpenes can enhance the effects of cannabidiol. Also, we know that omega-3 fats actually become endocannabinoids in and of themselves. In addition, they're working very closely with CBD. In fact, CBD will not work unless there is a sufficiency of polyunsaturated fatty acids like omega-3s. And furthermore, one other area is ketones. The body produces ketones when, as a result of an overnight fast or special diets, and these ketones have properties that are very, very similar to cannabidiol, especially on the nuclear receptors that we just talked about. So all of these are valuable, and they could play a role in enhancing the effectiveness of CBD for tuning up the endocannabinoid system, as well as recovering from many different illnesses. Let's talk about the management of somebody that has an illness and is on multiple medications and has the potential for an interaction of some sort. Definitely you want to review the pathways that are involved, but I'll tell you that, as we already talked about, they are unlikely and they're remote unless you're using very high doses of CBD. But I've learned to say that there is nothing absolute and there's always potential, so you're always on the lookout, and these are always going to be the concerns of your clients, and so you need to look at these and see what might be involved. Cannabidiol has the potential to inhibit and to potentiate some of these other drugs, and so that means make them stronger as well as inhibit their action. So as a result, you may be looking for effects on both sides, whether a decrease in the effectiveness of a drug or an increase in effectiveness. And typically, CBD does not have any side effects of itself. Typically, the side effects or the problems that people encounter are the result of side effects from those other medications, the ones that are either being potentiated or they're being decreased, and they're losing the effectiveness. There is also a lot of perceived side effects that people may have, and it's not sure where they're exactly coming from, what they are. You certainly have to examine those and review those carefully and not accept at face value what patients might imply or what they might be saying. Dose adjustments. When you're dealing with CBD and somebody feels like they are getting an adverse effect, then you can make dose adjustments either with the CBD or with the other drug. Now, most of the patients that come to me are on other drugs and they're having either side effects or they're not getting any benefit. So that removing those other drugs or tapering them or minimizing their use, it tends not to be a problem. You certainly don't want to do that without the physician's consent or the practicing physician who is working with them and who is their primary care. But it's very possible and very easy. Generally, I make dose adjustments in cannabidiol by cutting the dose in half. Unless I see that there's a great deal of sensitivity, in which case I will remove the CBD. I'll recommend stopping the CBD in order to decide whether those side effects are in fact related to the use of CBD. As we talked about in the perceived side effects, patients may be having a cold or another illness or some indigestion or something from one of the foods they're taking, and it may not be related to CBD. When you're dealing with a patient who has a boatload of medications, and it's not uncommon to have patients with 10 or 15 medications now, a slow approach may be a wise approach where you increment on a every 3-day or every week basis and make adjustments in the cannabidiol. Generally, I recommend making bold adjustments to increase to the effective level. In the case of the slow approach, we're going to be moving at the rate of change about every 3 days to see if they're going to develop any side effects from using the cannabidiol and their other medications. And then you can deal with that problem if something like that comes up. So I want to emphasize a number of points. Clearly, interaction is uncommon with cannabidiol. There are multiple pathways that are involved. It's really hard to pin down any one particular mechanism or pathway that could be taking place if you see some additional side effects. You always need to verify, in fact, that side effect is really coming from cannabidiol. And certainly you're going to be looking at those other drugs and the side effects that are associated with them rather than looking at cannabidiol, because you're not generally going to find anything. A lot of the interactions that are potential with cannabidiol are clearly unconfirmed. They have not been identified in humans with testing. So there isn't a lot of corroboration that these types of reactions are occurring. Finally, there's a cautious approach that you may have to have for those complicated patients with multiple medications. And one more thing is that positive interaction I was telling you about, how to enhance cannabidiol using special diets and the use of terpenes and omega-3s. Those kinds of combinations can really help patients and enhance the effectiveness while minimizing any types of side effects. So at this point, I'd like to open it up for questions. I've put together a reference folder. I will place in there some of the references that I've used on this particular report. So at this point, I would like to open it up to questions. The question is, if the patient is having any side effects from drugs, is that when you have to have them talk to their doctor to reduce the medications? Certainly, you're not going to make the decision to reduce any medications. You need to go through their primary care. But you can be an expert to help them understand what might be going on and stimulate them to go back to their primary care in order to make any changes that would be recommended. Healthcare provider may not be familiar with cannabidiol, but if a patient is telling them that they're having increasing effects from their medication, then a reduction in dose is not generally a problem unless there's a lot of resistance from the physician. So the biggest questions that I get are typically from epileptics, because they've heard so much about the interactions that can occur. There is always that potential, and oftentimes patients do get some effects that they're not sure exactly where they're coming from. You know, working with the patient very closely and looking at those anti-epileptic drugs and what I do is I provide them with a chart that I showed you in one of my earlier slides, so that they know what to look at and what are the references for those anti-epileptics. And if patients are not having seizures or not having any difficulty, then it's pretty easy and for the providers either to take a blood level or to reevaluate the patient to see if they need to be continuing on those particular medications. In my experience, I haven't seen very many drug reactions. There's always a potential, and I always leave that thought open that there could be, and I'll want to watch closely to find out if anything adverse is going on. In terms of side effects from CBD, the most that I see is a mild headache, some increased dreaming, and a fatigue that comes over people. And there may be some drowsiness. And so that's easy enough to decrease the dosage for the CBD. But that's not usually as a result of an interaction with another drug. It's mostly taking too high a dose of CBD. Can you please mention your pre- and post-surgery protocol? Generally, patients are, for major surgery or significant surgery, they are put on a no oral medications, no oral substances. And so if patients are adamant that they want to use CBD in that process, they can use it topically. I'm not inclined to interfere at all with pre- and post-surgery instructions. I'd rather back away from that and wait until before the patient goes into the hospital, using cannabidiol in the best way possible, whether that's oral, and that's usually the standard approach. I don't usually make any significant modifications. And after surgery, I'm going to wait until after they leave the hospital, because otherwise you're faced with some conflicts that are going on. Then it can be used topically if they have some limited oral issues about ingesting it. But the topical approach can be very effective as well. And when you use CBD topically, you can use it on the back of the hands or any other skin surface. I do recommend CBD when somebody is undergoing surgery, because we have had a number of patients who have been able to get away from their narcotics very, very quickly. In fact, patients who, when they've gone home, have not required any other medications, any narcotics, and have been able to use CBD alone. They're actually using the liposome product, and it was quite effective for them, as well as reducing the anxiety and apprehension and improving the sleep quality. So it is an ideal approach for post-surgical. Thank you all for listening, and I look forward to presenting more information about the benefits of cannabidiol in the future. Thank you.